Hi, my name is Glenn Boyd, and I'm doing my neurological assessment as well as a musculoskeletal assessment and abdominal assessment for Health Assessment 1. You always start by identifying your patient. So this is, well, actually, wash your hands. Do hand hygiene. I already did that before I got here. My patient today is Baby Yoda. um, and so to begin the neurological assessment, you would want to gain their level of consciousness. Are they normal, confused? You want to see if they're oriented to place, time, and uh, person. So that's where how you can assess that by asking them their name, their what the date is and where they're at. You ask them questions about how they got here, and that will you can tell if they have good short-term memory. When you're asking them these questions, you want to see, are they following along? Are they answering your questions appropriately? Do they have a logical thought process that goes through? You can ask them personal questions like date of birth and common knowledge questions like what are the four seasons, just to kind of gauge their level of, um, of neurological status. You also want to ask them things like, are they having destructive thoughts? Are they making good judgment while they're in the hospital? Things you're assessing while you're talking to them. Um, One of the things you can do is you take a cotton tip applicator and you're going to press it onto their four extremities, showing them what dull and sharp feels like, and then having them close their eyes and explain to you what feels dull or sharp as you do it with their eyes closed. Another thing you can do is the Babinski reflex, where you make an upside down J on the bottom of the foot, and the toes should curl. If they don't curl, that's a bad reflex. You can also have the patient walk 5 feet um, to see if the walking is smooth, that they have good gait, that they aren't stumbling, things like that. Um, Also, you can do the Romberg test where you have them put their feet together, close their eyes, and they should be able to stand still for 20 seconds. You can also have them take and put their finger on their nose and then back to your finger, and you can place it in like 6 different places in front of them, and they should be able to smooth it from your finger to their nose. And then you can also check Perla, which is pupils equally reactive and round, um, and light and accommodation. Um, or pupils equally round and reactive to light and accommodation. And that's where you're going to shine the light in and make sure the pupil reacts to the light. And then you're going to do it in the same eye, but check to make sure that the other eye accommodated. And you'll do that in both eyes. And so that's your neurological assessment. You can also check the cranial nerves just to assess those and see what's going on there. Now, on to our next assessment, which is going to be musculoskeletal. That's where you're going to look at you're going to want to inspect and make sure all the muscles are the same size and shape. The skin color around the joints is good, is normal. Any heat, any deformities, any pain when you do range of motion. You should do range of motion on the arms and then the legs, which the legs are under here. You want to palpate for any crepitus when you're doing range of motion, what their strength is, swelling masses, deformities, anything like that. So the big thing with strength is you want to make sure they can overcome your strong resistance. So you're going to want to have them pull and push your hands, raise their arms up and down, and move them front to side, and have them grip your hands just to test their strength. And they should be able to have a strong resistance, or at least overcome gravity. You'll have them raise their legs, lower their legs, and push and pull with their feet against the resistance of your hands, and make sure they can pull their toes back. Um, then you're going to check the spine for any abnormal curvatures. You want to make sure the spine is straight. There's no kyphosis or lordosis. And then next, you'd move to the chin and have them do range of motion. So you want to do chin to chest, chin up, chin to chest, chin up, head side to side, ears to shoulder. And then you want to have them twist side to side, and lean backwards. And that's checking all like your cervical, thoracic, and lumbar spinal motions. Um, and then the rest of the assessment really would be like having them with their shoulders. Can they rotate it? Can they abduct it and adduct it? Can they go forward, backwards, move it around, shrug? With your elbows and wrists and your hands, there's a lot of, can they flex it? Can it be extended? Can they do supination and pronation? Things like that. With your hips, can you do internal and external rotations, abduction and adduction, flexing and extending the knees? And then with ankles, you're going to want to check for dorsiflexion, plantar flexion, and then also like the supination, pronation, and rotation. And so a lot of it's just checking, can these body parts move properly? Whether it's up and down, side to side, rotating, things of that nature. So that's going to be your muscular assessment. Let's see, musculoskeletal assessment. Now, the last assessment we got here is going to be our abdomen assessment. Now, you're going to want to have your patient lay supine. So here I got my patient. You'll ask them, when did you have your last, sorry, that was right on their face. This is very odd with a stuffed animal because it's not how you would touch an actual patient. So, but you have your stuffed animal and you're going, or your patient, and you're going to ask them when their last bowel movement was, when they last urinated, to get an idea of how things are moving along. You're going to listen for bowel sounds in each quadrant. You're going to start in the right lower quadrant and you're going to go clockwise. So you're going to go over there and there. There's 4 different quadrants and you're going to listen to them for bowel sounds for about 30 seconds. If you don't hear any bowel sounds, you should listen for about 5 minutes to determine if there are actually no bowel sounds. So you're going to document it as normal, hyperactive if there's a lot of activity, or hypoactivity if there's like none, or very low bowel sounds. You're also going to check the stomach contour. You're going to see if it's flat, rounded, protruding, things like that. And then you're going to palpate the abdomen, and you're going to lightly palpate it, maybe 2 centimeters, and that should feel soft, and there should be no pain with that. Deep palpation, 4 to 5 centimeters, is looking for masses, lumps, or tenderness. You're also going to want to listen to, and I know I should be I should be listening to this with my stethoscope in. That's how you listen to the bowel sounds. You don't just go like that. But I do not have it on me. That was my my mistake, not bringing it with me to do my video. But you are going to put your stethoscope in and you're going to listen to these bowel sounds. And listen for bruitus, the vascular sounds in the aorta, the renal arteries, the iliac arteries, and the femoral arteries. You're going to do all that. So that is your assessment for neurological, musculoskeletal, and abdomen. Thank you.